Hi there. If you're watching this video, then chances are you're looking for a Medicare Part D drug plan. Today, I'm going to walk you through a step-by-step tutorial of how to use the Medicare.gov Plan Finder tool to research your medication costs, find the lowest cost drug plan, and enroll in that plan with confidence. So follow along as we get started. Now, the first thing you'll want to do is navigate to Medicare.gov. Once you're on Medicare's website, if you scroll down just a bit, you'll see a green button that says Find Plans Now. This will take you to the Plan Finder tool. Now you'll have two options to get started. The first option is if you have created a My Medicare account in the past, you can start by logging into that My Medicare account, which will simply allow you to save your medication list and your preferred pharmacies so that that information will be there when you come back in the future. You won't have to re-enter the information again. If you don't have a My Medicare account, or if you haven't received your red, white, and blue Medicare card yet, then you'll want to use the second option over here, which is what we're going to do today, and continue as a guest without logging in. So let's start by entering our zip code, and then you'll want to select the appropriate county that you live in. Next, it's going to ask what type of plan you want to look for. And since we're looking for standalone Part D drug plans, I'm going to select this middle option, which says Medicare Drug Plan Part D. Next, it's going to ask if you get any extra assistance from government programs with your health or drug costs. This would be low-income programs or other things like that, such as Medicaid, supplemental security income, things of that nature. If you don't receive any type of extra assistance, then just click the bottom option that says I don't get help from any of these programs and click continue. Next, and this is a very important step, we'll want to enter our medication costs. So it asks, do you want to see drug costs when you compare plans? Well, if you take any medications, then we want to say yes so that we can see our estimated drug costs in this tool. So I'm going to say yes, we want to see drug costs. And then this is where we're going to add our medication list. This is really important. You want to take your time and make sure to enter your medications accurately, as that way you ensure you get the most accurate pricing information. So I'm just going to add a couple of medications here. And if you enter a brand name medication, I'm going to click add. If your medication has a generic option, Medicare.gov is going to tell you that there is a generic, and you have the option to say, yes, I choose, I take the generic, or no, I take the brand name. So I'm going to say, yes, we take the generic. Then you can select the dosage, how many tablets you receive per month, and the frequency. Do you get 30 tablets every month? Do you get 90 tablets every 3 months? Of that nature. So you'll just want to select your quantity and frequency, and then once it's all correct, say add drug to my list. So we've got the first medication added. I'm just going to quickly add 2 more medications for demonstration purposes here. Add drug, and then all of my quantity and frequency looks good. So add to my list, and I'll add 1 more. PHY. All right, add drug, add to my list. So I've added 3 medications. Once your medication list is complete, you can come down to the bottom and click the green button that says Done Adding Drugs. Next, you can choose up to 5 pharmacies in which to view your medication pricing at. So you can compare prices at different pharmacies in order to find the lowest cost for your medications. So I'm going to come down and I'm just going to select a couple of different pharmacies here, and we'll say Walmart. So I've selected an HEB, an Alto, and a Walmart. Now when you're done, it's going to take you to the results page. And what Medicare's tool has just done is it's just calculated your estimated drug costs with every single drug plan available in your area. After it calculated those costs, it has now sorted the drug plans available based on the lowest drug and premium costs combined. So that's the lowest total out-of-pocket cost for the year combined is how it's ranked them. The plan here at the top of the page is the one that Medicare has figured is the least expensive plan for you based on your particular medications. Each plan, as you go down, Medicare estimates will cost you more money out of pocket over the course of the year. So the plan at the top of the page is most likely the plan that's going to be the best option for you based on your medications. So as you can see, it gives you the plan name at the top. It tells you how much the monthly premium is and how much the total estimated out-of-pocket costs for you combined with premium and drug costs at the pharmacy will be for the entire year. So this is the number that it's ranking the plans on overall. So you can see this plan through Cigna is estimated for my medications to cost me about $550 over the course of the year. If I go to the next least expensive plan, you can see it's going to cost $783 with this other drug plan. And as I go down, they get more expensive. That's why Medicare is recommending this plan at the top for me and my medications. So we know that this plan is likely the best one, but let's take a bit more or take a look in more detail at the plan. So I'm going to click this blue button that says Plan Details. And as I come in here, it's going to give me some more information. I'm going to scroll down just a bit. It lists each of my medications here that I entered, the quantity that I entered, the frequency, and whether it's generic or brand name. As I come down, I can look at the different pharmacies that I selected and see if they're not only in network, but if they're a preferred pharmacy. You'll always get your best and lowest drug costs at preferred pharmacies. So in this case, it looks like Walmart is going to be my best bet because it's preferred and it's in network. HEB likely to have slightly higher costs. While it's in network, it's just not preferred. And Alto appears to be out of network. Next, it gives you your yearly drug costs by pharmacy. And it's broken down by medication. So you can see, for example, that for this first medication at Walmart, I would have no copay. At HEB, I'd have an $80 copay. So that tells you how much each medication will cost you for the entire course of the year at different pharmacies. As we continue down, we can see our medication costs overall broken down by month. So this is all of our medications combined each month, how much it would cost at each pharmacy. So that way you can see your expected costs throughout the year. So that's how you look at more details on the drug plans. Again, the plan that Medicare.gov recommends first, the one at the top of the page, is in all likelihood your best option because the other plans are simply going to cost you more when you add up the premiums and co-pays over the course of the year. When you're ready to enroll in a drug plan, there's a green Enroll button right here on that plan. Or if we go back to the search results page, we can see here's the Cigna plan at the top of the page, and here's that green Enroll button. All you have to do is click Enroll, and then you can start the application. The application is very simple. You just want to make sure that you have your red, white, and blue Medicare card handy before you start that application because you are going to need your Medicare number off of that Medicare card along with your Medicare effective dates. I hope this was helpful. Let us know if you have any questions. We're always here to support you. Thanks for watching.